Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we'll talk about, flu, COVID, respiratory virus season. It's coming upon us, and so are the fall vaccines. So let's get into it.
Let's get into it. Well, our favorite vaccine, perhaps, the COVID vaccine. And the CDC is recommending everyone ages 6 months and older receive an updated 2024-2025 COVID-19 vaccine.
And I know we always have questions from our community who's immunocompromised because of chronic illness. And the questions are usually, do I get an extra dose? Sometimes you may not have as much immunity as, the average healthy person. So the CDC recommends talking to your doctor. They say you can get an additional COVID vaccine 2 or more months after taking the last one, but ultimately that should be a decision with you and your doctor.
That's a good number to remember, 2 months though, after from the last recommended vaccine. The updated vaccines are available for Moderna, Pfizer, and Novavax.
Yeah, and the updated vaccine is really to target the new strains, right? So we know it continues to mutate, and similar to how we address the flu every year, the experts look at what's circulating and they plan a vaccine that's going to most likely help against the newest strain.
Yeah, that's why these new COVID vaccines are called updated vaccines as opposed to boosters. They're expected to be updated annually. Boosters, by comparison, are additional doses of the same or previous formula taken to boost immunity.
Exactly. And if you think, I've gotten the shot, I don't really need to get another one. I mean, the news is that you have to. It does protect against severe illness, hospitalization, and death. It also enhances immunity that you have, like memory in your body.
Right.
And although COVID infections have declined and it's not as intense as the pandemic was in 2020 or like the few years after, there's still periods of upticks in hospitalizations. And from what we know about CDC data is that most of the people who are hospitalized had not received the updated vaccine.
Yeah, that's right. In fact, in 2023, more than 900,000 people were hospitalized in the U.S. due to COVID, and more than 75,000 people died from it. And most of these people had not received the updated shot.
Yeah, and also, I know a big concern in our community is long COVID, and the vaccine also reduces your chance of getting long COVID because it reduces the severity of the virus.
Yeah, absolutely. That's a really good point. So let's talk about our other favorite seasonal vaccine. I don't know if COVID's seasonal yet, but the flu vaccine certainly is. The CDC recommends that everyone 6 months of age and older receive an updated flu vaccine.
Yeah, and this one for this year is a trivalent. This is so scientific, but if you're interested, it protects against H1N1, H3N2, and a B/Victoria lineage virus.
Very cool. Wait, so let me just ask you, are you going to get both at the same time?
I actually did. So I got it last week.
Whoa. Boom.
Yeah.
Wow.
Yeah, I guess I can tell you a little bit about that.
One arm or two?
I did one in each arm. I wasn't brave enough to do it in the same arm.
Wow.
It went totally fine. I talked to my rheumatologist first about, adjusting my treatment plan. And actually, one of my medications I didn't have to pause, which I've had to pause in the past. So it's just good to, even if you think just ask your doctor again, because I was really excited about that.
Oh.
Okay, so I actually asked the pharmacist, are people coming in? Are people getting both? What's the deal?
Right.
Because I knew we were going to talk about it. And she said most people are getting both at the same time. Some older adults, their doctor suggested, get COVID now, but come back in a few weeks for the flu.
Yeah.
And the pharmacist was kind of up in the air about if that's totally necessary. If you're going to come back for the next appointment, sure. But if it's going to be a pain to book another appointment, then just get it done at the same time, she said.
Right. Interesting.
Yeah, she also said Mondays and Fridays seem to be popular days. So if you're in New York City, you might want to book a different day.
Monday and Friday. Okay. Yeah, because you do have to sort of plan ahead in that, particularly when you're getting two. It can have the effect of wiping you out, making you tired and drowsy and whatnot, to mention a little localized pain in your arm where the shot is.
And then actually there was a few things that were different this year for me. So one, we've had the COVID vaccine card in the past. And even last year, I was still asked about about it, but this year I wasn't asked about it at all, which was good because I didn't even think about finding it, but I realized once I was at the appointment. I also got, when you pick up a prescription and you get those little like scripts with your pills, it's like all the information about it. I was handed those about the vaccine, which I'd never been handed before.
Interesting.
So I got to like read up on what I got. And then also I didn't have to wait the 10 minutes to see if I had a reaction. She said, just go ahead.
Just get out of here.
Yeah.
Faces a premium in New York City, I guess. We don't have time for a waiting area.
Well, I think it's just, now that the COVID vaccine's been out a few years, like we can confidently say most people aren't having a reaction at the time of vaccine. So they've eliminated that, I guess, preventative measure.
Wow. Well, that's great. That's exciting. I guess we could go behind the curtain. We're recording this in late September. I'm planning to get both of my shots in mid-October, so I'll be right behind you, so to speak. And good to hear that all went well for you, and I'm looking forward to it myself.
Awesome. Yeah.
But there are folks, by the way, you can get vaccinated with the flu without getting a shot now.
Ooh, do tell.
Well, in September, the FDA approved a FluMist for self or caregiver administration for prevention of the flu. FluMist, as the name implies, is a mist that is sprayed into the nose.
Very cool. I was actually looking up on this because I was like, oh, is this an option for me? But actually, it's not recommended for people who are immunocompromised right now. So I guess this is more like informational for our community rather than like ask your doctor about this.
Yeah, okay, that's fair enough. I think I prefer the vaccine anyway. I know it's getting in there. Whenever I use those mists, my nose, I never know how much I'm getting in and how much is blowing out anyway. I want the full stuff inside my body.
That's true, yeah.
So I'll stick to the injectable. I'll let the professionals take care of that and get it in me. But still, in all seriousness, it's good to have more folks out there. More options for the general public is always a good thing.
Yeah. Also, I saw that, when you look at it compared to the injectable vaccine, there actually is not like a consistent answer on which is more protective. There's obviously more data on the injectable vaccine because that's been around and widely used for a long time.
Right.
But there is some evidence to say that because the FluMist goes through your nose and the flu also comes in through your nose, that it can have like extra protections in like how deep the respiratory virus goes.
Whoa. Okay. Well, it's good to know. I guess it's something we'll keep our eye on. Maybe in 5 years, we'll all be taking the mist. And it's, like I said, it's good to have more options out there for folks, particularly an option where you don't have to make an appointment, make it more likely that people will follow up on that.
Yeah, actually, it's available on an online pharmacy, like through the manufacturer. There's a screening process, and then the pharmacy will prescribe and ship the FluMist. So it's a little bit different. You can't just walk into your regular pharmacy right now to get it seems like.
Excellent. Well, in terms of timing, basically by the time you're hearing this recording, you should be getting it approximately now. The CDC says September, October are the best times for most people to get both vaccines. Obviously, talk with your doctor to get more specifics on that. If you really want to nail down the exact date, that's quite impossible to do. The exact date would be like 2 weeks before some cresting of the illness is coming, but it's impossible to predict with particularity. So my plan is personally to be vaccinated at a high rate before Thanksgiving, for example.
Yeah, I was going to say that. Like you've said this in years past, if you're not having much plans before the holidays and then the holidays are coming up, it's a good idea to time it like that. I kind of was of the I just want to get it done so I don't forget about it, especially because I do have to adjust my treatment a little bit. Like I wanted to take that into consideration. When I didn't have plans, it's okay to feel a little worse. So yeah, I really feel like it's just up to the person.
Right, totally. And depending on how you react to vaccines, I'm someone, at least with the COVID vaccine, with the mRNA shots, I am somebody that definitely feels it and wants to make sure that the next day I'm prepared. That day, later afterwards, as well as into the next morning at least, I don't have anything major going on. So that's a factor too.
Yeah. Actually, I only felt a little bit tired. I was surprised at how good I felt. I feel like the chronic illness community would relate to this. I feel worse after the hangover from my regular injections than I felt from the side effects of the vaccine. It's almost like, yeah, I'm used to getting shots and feeling bad. It was totally fine.
Right. It's like, this is so non-scientific to say, but it's like sometimes you go out and you have a drink of alcohol and you feel just disgusting after. And sometimes you have multiple drinks and you're totally fine. There are just factors that I'm not wise enough to understand, and who knows. But still, better to plan for the worst and get lucky.
Also hydrate. Oh my gosh, I drink so much water and I think that really, really helped.
Okay. There you go. I'll be doing that. What about the RSV vaccine? How's that looking?
Yeah, so RSV vaccines for older adults were new last year, and they're recommended for anyone 75 and older or those 60 and older who are at high risk. Otherwise, it's really just available for pregnant women, so you can pass along antibodies to newborns or babies under 8 months. So for the general population for RSV, there's no vaccine right now, and we could just think about our other protections like masking and hand washing and distancing.
Yeah. And also, very important, rapid tests. There's another round of free rapid tests that are available from the federal government. So you should definitely get your hands on those because it's good to know when you or someone in your household is coming down with COVID to protect yourselves.
Totally. Also, like especially around the holidays, if you find yourself kind of not feeling well, maybe you can't get an appointment to test or things are backed up, not open. It's good to just like have the rapid test, feel confident you could do it, like get an answer within 15 minutes, and then you can go about your plans or not.
Yeah. My tests have been expiring because I had so many.
Mine too. I just did this round of orders, so I'll let you know when we get it.
That's good. Yeah, I found myself I had so many and I found myself using them even with like a sniffle just to make sure because I knew that these things were not really useful anymore or the usefulness was expiring as well. So it's good to resupply.
Well, yeah, just a quick plug also before we wrap up. Our Informed Immunity podcast is back, hosted by our colleague Susan Jara, who's the Director of Patient Education here. And it's a podcast that's just going to explore the role of community and equity immunization, debunking vaccine myths, navigating the healthcare system, and the latest on vaccine research. So definitely check it out. We'll drop a link in the episode description.
Excellent. Wow. Well, you know what? I'm going to go with that as my learning. I'm learning that I didn't realize that we had a new season of Informed Immunity coming out. So I'm looking forward to that. Looking forward to learning more on the world of vaccines.
Definitely. And for me, I learned a lot about the FluMist vaccine in preparation for this podcast and excited to see just like advancements in this space.
Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts, such as Informed Immunity and more at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.